just would not be captured in the numbers. At emotional stressors in terms of the what happens to the muscles when people encounter emotional events, and it's not uncommon for people to clamp down when they do that. I guess the one of the things that's kind of important or interesting is that the site of placement is real important. And you can do bilateral electrode here and here and just get general lower face. Or it may be important to look at right and left side independently. You can look at masseter, temporalis, the gastric, neck. There are a number of different sites that can be involved, and trying to figure out which one best reflects the disorder that you're looking at can be tricky. The TMJ people that I'm aware of basically say that when it begins to go down onto the neck, that the problem of just being a joint problem gets smaller and smaller, that then it becomes more and more likely to be a muscle-related problem. And
is part of the goal of TMJ to see whether the two sides are out of balance, as different from bruxism, which I guess is general just grinding? Do you know anything about the relationship between TMJ and bruxism?
You don't necessarily have one if you have the other.
Yeah.
Right. Most bruxing is nocturnal, occurs at night. It's the dental people know about it because of the wear patterns on the teeth. It's a real hard one to treat because it's nocturnally based. And there have been attempts to try to use, EMG alarm systems to try to work on the bruxing part, and I think they're partially successful. The TMJ seems to be much more readily amenable to biofeedback-oriented work. Usually you do physiotherapy, some kind of stretching and strengthening exercises that have to do with range of motion of the mandible and neck, and then you do relaxation-based oriented work, and then you do stress management. But it's really more, more general relaxation-oriented things.
Especially as you go down the neck, as it moves away from the jaw into the neck.
Yeah.
And throat. Thank you.
Okay, are we ready to do another print here? What do you think? I'm going to go ahead and there's a selection here that says view bar graph of trial averages then print. That. So we'll go ahead and do that one. So what the computer's doing now is it's actually going to graph it for us. Okay. So this is the frontal EMG. Okay. And it's depicted in a bar graph form, and so you can see what we saw in a line bar, but now we've got it segregated out. So this is just frontal EMG. You can change the scaling if you want to. This looks pretty adequate for me. This is 0 to 10. And then you press P to print.
0 to 10 what?
Huh?
0 to 10 what?
Sorry.
The scale, in terms of scale.
The scale, it's 0 to 10 microvolts. That would be good to put a title on the side. So this will just print out a real nice little graphic representation of that. And see, the other things that they're doing with TMJ these days is splint therapy. know if you've encountered that, but having people wear a piece of plastic that separates the teeth. And there are actually studies that have looked at the comparative efficacy of giving somebody a $600 splint or giving them a relaxation tape that basically says let your jaw hang loose, and a tape that costs $3, and the efficacy is about the same. There's a fair amount of research that happens at the University of Washington, and they're not real pro splint therapy, and so they tend to generate data that supports their theory. There's also a group in Seattle called Myotronics that builds specific instruments for the work on TMJ, and they do 8-channel recordings. They do 2 temporalis, 2 masseter, 2 digastrics, and 2 necks, I think. And then they have people go through a protocol, and their instrumentation is such that they can actually have people do a bite like this, and they can tell which side hits first by looking at the way the muscles are organized. Boy, that is a long printout, isn't it? What I have on my system at home is a spooler, and so what I do is basically when I hit these things, it goes into a spool, and then sometime later on during the day, I just dump it all. When I'm doing my office notes and stuff, it's just pumping out paper. So I don't know if we're going to go through and look at all of the different graphs. But there's that one.
Jeff, just going back to the TMJ, you mentioned the stretching and strengthening. Do you do that? Does a psychologist do that with the biofeedback?
Well, usually what I end up doing, let me just get out of this so I can focus. Okay. You want to take him first? Okay, so usually what I do is I work in conjunction with people that do physical-oriented therapies. And I do some, and they do some. And hopefully what we're doing works together and we dovetail. And so in Seattle, what I've ended up doing is identifying 3 or 4 different physical therapists that are within my catchment area that I can use. Mainly because not all physical therapists are good at treating all disorders. Matter of fact, there are only 5 or 10% that are really trained to deal with chronic pain disorders.